TVs, Gideon, are you ready, Gideon?
Yep.
Devise is timing. Are you ready, Devise?
I am.
Mason, it's you. Go ahead.
I'm going to assume none of you have any idea what ITP is, and that's because on my Google form, 8 out of 10 of you said you had no idea what it is, and when I asked what it was, none of you gave the right answer what it was at all. Well, immune thrombocytopenia purpura is an autoimmune disease that directly affects a little under 200,000 Americans a year. Since it is a disease that is prevalent in this country, it is studied and researched heavily across the United States and the world. Today, in my informative speech, I will explain to you what ITP is, what ITP does, and the treatments available for ITP. Immune thrombocytopenia is a common autoimmune bleeding disorder. The understanding of ITP is rapidly evolving. Doctors now recognize ITP as a complex and heterogeneous syndrome. And what heterogeneous means is it's multiple causes for it. It's just not very consistent in how you get it and what it does to you and treatments that you respond to. The syndrome, it results in cell-mediated attacks on platelets in the bone marrow. What platelets do is when you get cut, scratched, or you start bleeding, it will come to the cut and it will clot and stop you from bleeding. And when it starts attacking the platelets, you will bleed longer because you don't have enough clotting. ITP patients are present with variable bleeding severities and treatment responses that do not closely correlate with platelet count, as stated by oncologist Oriana Matildius. So basically, what this means is you have T cells in your body that attack infected cells in your body. But instead of attacking infected cells, they attack your platelets. And symptoms of ITP vary from person to person. But common symptoms are bruising anywhere and everywhere. If you bump anything like that, you'll bruise pretty heavily. But the most common one is bleeding, specifically in the mouth. Your gums will bleed, and the back of your throat will bleed a lot. The purpura part of immune thrombocytopenia purpura is this. And what purpura is these red, purple dots. Purpura is a rash of purple spots due to small blood vessels leaking blood into your skin, your joints, your intestines, and organs, stated by Dr. Mohammed Macaulay. So now that we went over what ITP was, it's autoimmune disease, what it will do to you, fatigue and destroy your platelets, we'll go into why ITP happens. As of right now, ITP isn't very well understood, and there's two types of ITP, primary and secondary ITP. Primary being the most common ITP, and primary means there is a cause that you can trace back that triggered the ITP. Common causes of ITP triggering are viral infections like chickenpox, bacterial infections like pylori, medications like antibiotics, and pregnancy can trigger ITP also. Those are the most common ones. Secondary ITP is ITP without a cause, ITP without any cause of thrombocytopenia by history, stated by vascular surgeon Krishna Vishal. With the little understanding of ITP that we have, we do know a few things, and one of them is ITP in kids and adults are different. Dr. Jenny Despodovic wrote this article about it. It is understood that ITP in kids is acute and curable, so you don't only have it for like usually 6 months to a year. but in adults, it tends to be chronic and it will not go away. But unlike most autoimmune disorders, ITP does not get worse with age, so if you do have it as an adult, it won't be as bad as other autoimmune diseases. We also have found, doctors have also found that pregnancy greatly increases your chance of getting ITP. On average, 1 to 2 mothers get ITP in 1,000 pregnancies, stated by Dr. James Russell. And now that we went over why ITP happens, we don't really know why it happens that greatly, but there's a few reasons why. Go into medication. Treatment effectiveness varies from person to person. Like I said, it's heterogeneous, and that comes in with treatments too. Sometimes you'll respond to some treatments pretty well, other times you won't at all. Most common treatments, most common one is this corticosteroid. It's an oral steroid, and it'll just basically boost your immune system, and you hope to boost platelet production in your bone marrow. There's IVIGs, which is an antibody transfusion, which is that. You get it through an IV drip in your arm or your hand, and it'll just, your body will get antibodies from other people's blood, and it'll hope to, again, boost your immune system and boost platelet production. There's bone marrow transfusions where you get put to sleep and get a needle like that long stuck into your bone marrow, and then they again shove antibodies into it and hope to boost platelet production. The last resort is they will remove your spleen, because your spleen is the thing that starts attacking your platelets and kills the platelets. So if you don't have a spleen, there'll be nothing to destroy your platelets. But all these are treatments for ITP, but it can also be used as a game of exclusion, because ITP, since it's not understood, it can present as a lot of other diseases. So sometimes we use medications like that to exclude other diseases, to diagnose ITP. Now that we talked about most of the treatments, there's other treatments like pills and liquid medication, but those are the most common ones. Knowing the impact of ITP, ITP has impacted the lives of millions of people from all age groups, young to old. ITP obviously has physical impacts on you. Like you can't do a lot of things, you might die from bleeding. It also has a mental impact on you, because again, you can't do a lot of the things that you could do before. Financial burdens also, if you have to go to the hospital for it, you might have no money, nobody can. Today in my informative speech, I have explained to you what ITP is, what ITP does, and the treatments for ITP. And I think one thing you can learn from this is don't get ITP, it sucks. Thank you for listening to my speech.